Hi, it's your friendly dialysis nurse Sheila, and for today's video, we are gonna educate patients in caring for their AV fistulas. So, the first goal of this education is to promote self-care management in patients with AV fistula access. Secondly, it will empower patients in managing complications through constant assessment, early reporting, and intervention. So before we begin, let us know the meaning of self-care management. Self-care management is empowering patients to take control of over their health, over their illness, through lifestyle changes, managing their symptoms, as well as taking care of their fistulas. So there are three types of access that we use during hemodialysis. The first one is the arteriovenous fistula. Second one is the arteriovenous graft. And the third one is the central venous catheter. Amongst all the three mentioned, there are advantages and disadvantages. So according to Robert Brown, 2024, vascular access is the Achilles heel for hemodialysis patients, and is a vital part of a successful life-prolonging treatment. It is also known as the lifeline of hemodialysis patients. All right, so amongst the three, AV fistula has been considered the optimal access for hemodialysis because of its qualities, such as low infection rate, having least complication, its accessibility, and of course, the quality of longevity is the top classification or characteristics of the AV fistula. That's why it's the first option for dialysis. Before we proceed to the management of AV fistulas, let us understand the barriers of the optimizing vascular access. So according to Robert Brown, there are two types of barriers that he mentioned in his studies. The first one is the access in itself. So the ease of creation can be a barrier because AV fistula requires a good vasculature, so a good vein and arterial structure is needed for a successful creation of fistulas. Another one, it takes a while to create, so it will take more than 4 weeks or months before we can access or we can use the fistula. Number two, the ease of use. It requires venipuncture, so 2 needles is essential or necessary to put in to start dialysis. And number 3, complications is it may cause post-dialysis bleeding. It may develop arterial steal syndrome, aneurysms, a neuropathy in the arm, or breast edema. But these are the worst cases. All right. Also, some of the barriers that he mentioned in the study is patient characteristics. So let's start with demographics. Patients more than 65-year-old have the tendency of less developed fistulas, as well as it could be related to the sex. So according to Robert Brown, in the US, females are less likely to have AV fistulas than the males. Also, their physical characteristics, such as having different illness or comorbidities, including heart disease, diabetes, therefore preventing AVF maturation or the fistula maturation. Also, quality of life considerations. Some patients, they prefer not to have the fistula because they find that it's impeding or they're physically changing their body. So that could be a hindrance of creating AV fistulas. These are a few of other documented barriers in maximizing vascular access. As healthcare professionals, we have the vital role in giving information, practicing comprehensive assessment, encouraging patients to participate in planning appropriate vascular access for long-term hemodialysis. Now, presuming that AV fistula has now been chosen by the patient and the team and has now been created, you as a patient has a crucial role in monitoring and making sure that the AV fistula is starting to function. Here is how. Number 1, check the surgical anastomosis to see signs of infection. So you're looking at redness, any swelling, any feeling of warmth or heat and pain. So make sure that you report that one. Number 2, palpate for the thrill. Number 3, listen for bruit. So bruit can be assessed by using a stethoscope. So when you are in the unit, you can ask one of the nurses to borrow one of their stethoscope and make sure you hear that bruit so you can assess and ensure that there is that bruit every time you check your access. A good practice to do this every day. When the AV fistula is mature and reaches a stage where it can be used, make sure to wash your fistula site with soap and warm water prior to use. This prevents infection during cannulation. Number 2, keeping the skin over the fistula hydrated. So you can put a bit of moisturizer, making sure to avoid the itchiness, dryness, and also removing the bandage the day after dialysis. It's also a good practice to wash the site after you remove the bandage. Additionally, avoid heavy lifting. Okay, do not sleep over the side of your access. Do not wear watches, jewelries, or any restricting tight clothing that could restrict or constrict your fistula. Avoid blood collection or blood pressure checking on the fistula arm. This prevents vascular access damage. So, those are the ways that you can help us, or you can help manage your fistula in behalf of the healthcare workers. This would promote independence, that you yourself is aware that your access is still working and you're doing your part in looking after your fistula. So, I just want to add the signs of Steele syndrome. According to a study by Varma et al. 2022, dialysis access associated Steele syndrome is an infrequent complication after hemodialysis access creation. So clinical symptoms that we need to watch out for is the coolness, pale looking arm, mild paresthesia or numbness, pain during dialysis to severe symptoms such as pain at rest, paralysis, ulceration, tissue necrosis, and loss of finger. So we have to be very careful with Steele syndrome. And if you're concerned, make sure you escalate or you let your nurses or your doctors know about it. As healthcare professionals, it is our job to do access. So assessment, cannulation, circulation, checking for signs and symptoms, and surveillance. So in general, we do inspection, palpation, auscultation, and evaluation of our findings. We also make sure that there is no cannulation difficulties. We make sure that we achieve the pressure parameters and ensuring that the patients get good clearances. We also check for recirculation and evaluation of access function. What are the signs and symptoms that we need to watch out for is the prolonged bleeding, ipsilateral swelling of the arm and chest, arterial seal syndrome, which I mentioned earlier, and also arm pain. Now, what do we do to prevent further complications with your fistula? So we do periodic surveillance, we do transonic measurements, we do monthly bloods, and we also check for other recirculation studies method. Lastly, here are the common complications that I want patients to be aware of and make sure that you are confident when you encounter this kind of complications. So infection, prevention of monitoring for infection involves checking for redness, swelling, heat, and pain of the fistula arm. Always observe hand washing or washing of your fistula arm prior to any cannulation or any dialysis procedure. Report accordingly. So if you're concerned that you notice any redness, anything unusual in your fistula arm, make sure to let your nurses know. Number 2 is bleeding. So bleeding can happen in the unit. Bleeding can happen at home. So when bleeding occurs, always apply firm pressure on this site or both sides for a minimum of 10 minutes. Make sure that your bleeding pack is always accessible to you or handy. So bleeding pack includes gauze, dots, and tapes. Make sure that your family member is also aware where you put your bleeding packs. And if you run out, always check with your unit if you can have some more. And if bleeding persists, proceed to ED for proper management. I'm hoping that this video would help you manage over complications with your fistula and also give you that confidence that you can also look after your fistula and you do your part in looking after yourself. So again, it's Sheila. Thank you for watching this video. Bye!